Well, welcome to Health Bites, and thank you everyone for joining us. My name is Margie Shepard. I'm the Community Engagement Coordinator for Region 3. I am joined today by my colleague, Jen Ortiz and Bailey Sterling, who will be monitoring the chat and posting links. It's my pleasure to introduce our guest speaker, Dr. Sophina Manheimer Calderon. Dr. Calderon is presenting on the impacts of the COVID-19 pandemic on the Navajo Nation and a story of Diné resilience. Dr. Calderon is Diné from Tuba City, Arizona, and a graduate of Dartmouth College. She obtained her medical degree at the University of Rochester School of Medicine and Dentistry and completed her residency at the University of Rochester Medical Center in Rochester, New York. She trained as a family physician with an emphasis on women's health and global health. Dr. Calderon currently serves as the Chief of Staff at Tuba City Regional Healthcare Corporation on the Navajo Nation in Northern Arizona. She is the HIV officer for the facility, providing specialized HIV/AIDS treatment and prevention for adults and adolescents on the Western Navajo Nation. With the commitment to global health, Dr. Calderon also serves on medical brigades to Honduras with the University of Rochester Family Medicine Residency Program. The program teaches its residents, physicians, and the skills necessary to help other communities improve their health, a skill that Dr. Calderon is grateful to bring back to her hometown community of Tuba City. Dr. Calderon received the 2017 Humanitarian Award from the University of Rochester School of Medicine and Dentistry, which recognizes dedication to providing medical care to the underprivileged and underserved. She recently received the 2021 Gabe Zimmerman Public Service Award as a community builder from the Center for the Future of Arizona. She was also named the 2021 Exceptional Rural Health Professional of the Year by the Arizona Rural Health Association. Since the pandemic, she's been assisting the EPI response team at TCR-HCC with their COVID response to the pandemic. Her focus has been on community education and outreach. Thank you, Dr. Calderon, for joining us today. And right now, I'm just going to pass this over to you.
Thank you so much. Just wanted to formally introduce myself in my native language. Yate she Sophina Calderon nishe ki ani nishlento lukatane bashichin ashi dashiche do thaba dashanale. I'm actually originally from Tuba City area, where I currently work. I was born and raised here. I currently work and deliver babies in the hospital that I was born in. So it's great to be back and work in my hometown community and just truly take care of my relatives, my family, and my extended family, and all those who are related to me. And so I'm very honored to present for you all today. I just wanted to share a little bit about our COVID-19 story, is what I'll call it. And most of my presentation is going to be focused on this idea of resilience and how, despite the worst outcomes or the worst sort of onset that we've experienced with this pandemic, at the onset of the pandemic, we've actually come out on top to be very strong and resilient people. And our I'm going to show you a pictorial journey for the whole second half of this presentation that'll sort of demonstrate that. So I actually am going to turn off my video to optimize my sound. So I think, all right, next slide. So my usual disclaimer, I have nothing to disclose. Anything that I mention in this talk are solely my own opinions and don't represent the opinions of the Navajo Nation, the Indian Health Service, or the hospital that I work for. Next slide. Just a quick outline, an introduction to where we are located here on the Navajo Nation, and with respect to where we're located with respect to the rest of the United States. Tell a little bit about our COVID-19 story, and discuss a bit about health inequities and sort of present a structural framework for looking at health inequities, and then transitioning to talk about this idea of resilience, and particularly Diné or Navajo resilience, and just a couple of suggestions of ways to help for future reference. Next slide. So the Navajo Nation is located here in the Four Corners area. The majority of the Navajo Nation is in the northwestern part of Arizona, a huge bit into the New Mexico area and into Utah. And Tuba City is actually on the western end of this pictorial of the Navajo Nation, and it's right borders along the Grand Canyon. So the eastern end of the canyon has some land up in the northern part of the canyon land. Next slide. So the Navajo Nation is over 27,000 square miles with a population, according to 2010 census data, of 333,000. It's divided up into 5 agencies. So there's northern, eastern, southern, central, and western. Tuba City, where I work, is located on the western agency side in yellow, and it is further subdivided into 110 chapters. So this is just a subdivision by which the Navajo Nation sort of passes down its governing capacity down to the most local level, which is down at the chapter level. And our population percentages show that out of the 333,000 population or people that are registered Navajo, the 47%, so close to 50%, are located on the Navajo Nation land and live on the Navajo Nation. And then we have a lot of an increasing percentage, probably over 10% by now, well over 10%, that live in bordering towns. So towns that are just off the Navajo Nation, where a lot of people go to work, and a lot more people who commute farther away to cities outside the Navajo Nation. So for example, Phoenix and Albuquerque, and even further out, where people go for work. Next slide. So our age distribution, a huge percentage of our population is in that 20 to 60 age range, and a growing number of our age groups are in that younger age range under 20 as well. So there's our population density is 19 persons per square mile. And when you think about in the larger US population density, there's 345 per square mile. You know, in comparison, when you look at population density, it would seem that there are fewer people per square mile, which when you've ever driven across the Navajo Nation, you know, you pass through miles and miles of open land and see scattered clusters of homes in the horizon when you drive through the Navajo Nation. And this is important to when we sort of think about COVID-19 and the spread of an infection during a pandemic. And, you know, you would think that if we're less dense and there are fewer people per square mile, that the spread of infection would be much less. And I think that was what was thought initially. And so we'll talk about the factors that contribute to that further on. And the average household size back in 2010, according to the data, was 3.5 persons. And it was said that children under 18 are 4 times more likely to live with their grandparents, so contributing to a multi-generational household. There are now an increasing number of multi-generational households, so children living with their parents and grandparents, and now a lot of great-grandparents, aunts and uncles, so growing households that are of a large mixture. And the median household income was $27,000. So this is actually half that of the median household income for the rest of Arizona. Over 42% are unemployed, and greater than 38% live below the poverty level. So I'm waiting for the updated census data to sort of be released. We're still looking for that to sort of see how these numbers have changed. Next slide. So this is a pictorial, sort of a graphic version of the cases on the Navajo Nation. So these are daily data points of cases per day. And the onset of the pandemic, so early on in March, is when we first started to see the first case here in the United States. And if you can recall back 2 years ago, when we were following the story of COVID-19 and seeing the news of this unknown infection rising in countries across the globe, and then showing up here in Seattle area, in New York City, and we were watching and counting the rise day by day. You know, we would sort of see an uptick and say, oh, there's 100 new cases today, and the next day and see, oh, there's another 200 today. And just to really watch that slowly increase with time, and then all of a sudden spike and shoot up, and then just appear over the rest of the United States. So back when everyone was watching their televisions and day to day looking at case rates, the Navajo Nation first had its first case in early March, and this came from a super spreader event, from a religious event in one of the areas on the western end of the Navajo Nation. And from that, you know, this was a gathering of people that came from all over the Navajo Nation, but also off the reservation, people who traveled from, you know, Phoenix and Tucson and other outlying areas to attend this event. And a few people were symptomatically ill at that event, and that's when the spread happened. So these people went from the event and went home to their own hometowns, all over across the Navajo Nation from wherever they had come from, and started to spread the infection from there. And then we saw our first case in Tuba City on later on towards the end of March. And then just, you know, we had a spike into April and June, and just, you know, revamping our triaging and protocols, shutting down our hospitals for normal routine outpatient care, and pushing a lot of our efforts into triaging and manning a screening tent and screening people outside the hospital, and trying to triage many sick people, and many of which had presented quite ill and already in the advanced stages of the illness, you know, people showing up and becoming and needing intubation right away. And so we sort of started to see a calming through the summer and into August. Messages were spread about, you know, masking up and staying home. Lockdowns were imposed, and all across the Navajo Nation, we all had to be in our homes by 8 p.m. The towns were sort of quite desolate and quiet and dead after 8 p.m. And then people went to work the next day, and a lot of businesses were closed, and I think the only things that were open were a few grocery stores with very, very limited opening hours, and a few gas stations, and of course the hospital. And so we started to see an improvement of numbers. Things calmed down, and then once the summer hit and people moved indoors and started to spend most of their time indoors with each other, then we experienced our next spike, which I think by the time winter hit, this was the third spike in the rest of the United States, but this was barely our second by that time. And that's when we had experienced some of the highest numbers that we had seen since the onset of the pandemic. And while the rest of the United States was dealing with spikes, per capita spikes higher than what we were experiencing here. And so, you know, after vaccinations, so once the vaccinations started at the end of December into January, we had a huge vaccination campaign that really significantly helped decrease our numbers. And you'll see that nice flat timeline of low numbers of COVID cases from February onward into August. And, you know, we enjoyed such low numbers, really spreading the good message of vaccinations and seeing that vaccinations help prevent severe illness and death from COVID. and just sort of a collective effort across the Navajo Nation to really protect, not only protect ourselves, but also this common theme of also protecting each other and our elderly. And then most recently, towards the end of 2021, some spikes that started to break through with our Omicron variants, and then our most recent BA2 variant that's starting to increase. And so then our next spike in February, fortunately, the spike, our most recent spike in January into February are milder cases and mostly vaccinated people that are asymptomatic and don't have many severe symptoms at all. So not much of an effect on our hospitalization rates, but still a spike in number of cases that were tested positive. Next slide. And just our age breakdown in terms of those who did get COVID by age group, similar to the rest of the United States at the onset of the COVID-19 pandemic, those that were most affected in terms of severe illness and death were those in the older age groups, so 16 over, experienced the worst symptomatically, but also our worst, experienced a higher number of death rates in those age groups. And in the as far as those who were infected, over time, cumulatively, younger and younger people were becoming infected over the course of 2021, but fortunately didn't experience a much change in terms of death rates. We're concerned. Next slide. And this is our COVID-19 dashboard by the Navajo Nation. They have the Navajo Department of Health that mans this dashboard and updates these cases daily in terms of total number of confirmed cases as of May 2nd. And it hasn't really changed too much since May 2nd. Our numbers are still on the lower end day to day. I think there's just been a small spike in the past week, but otherwise these numbers are still about the same. But they started to follow not only total of confirmed cases, but also a lot of people were tracking and like to see the total number of people that have been recovered from COVID. So those who experienced COVID and recovered and are now back home and no longer in this severely ill phase. But this doesn't really account for the number of people that experience long COVID symptoms or symptomatic in one way or another for the long term after recovery from COVID. But for the most part, the people like to see that the numbers of those being recovered compared to the total number of confirmed cases, that those numbers are looking pretty good and that our death rates don't continue to climb day by day. Next slide. So looking at this, I mentioned, a lot of people have asked, why is it that in such a large land area with such low population density would COVID or a pandemic like this spread so far and wide and have some of the worst death rates for COVID and per capita have high infection rates. And so just looking at some of the structural sort of things, our infrastructural things here on the Navajo Nation, but also factors, health factors and other things that contribute to higher rates of infection and also more severe presentations of illness and higher death rates. So, I kind of broke this down into 4 specific categories, looking at, exposure. So factors that put our people at higher risk of being exposed. So, and then I'll explain more of that in the future slides. And then infection and complications. So this is a category of looking at factors that put people at higher risk for severe COVID illness, and also factors that would also complicate a person's experience in this pandemic. So saying that a person here in the Navajo Nation would experience COVID and their sort of experience of management and recovery from COVID being different or even significantly different from a person who lives off the Navajo Nation that is not, that is not native. So a non-native person living off the Navajo Nation in a city somewhere that might experience COVID a lot differently. And then a category that I put in for that accounts for protections. So factors that should be in place to reduce a person's, factors that are there that reduce a person's protective mechanisms. So things that are there that we would expect to help protect us from infection, from spread of within a pandemic, and what are those factors? And then supports, having inadequate access to supportive factors that could help reduce the spread of COVID and reduce the severity of COVID illness. Next slide. So looking at exposure. So, just sort of putting together a list of things that sort of we consider in this exposure category. So this essential worker status. So working in higher risk jobs or having a job where, coming from a personal home or household experience where you really have to go to work and you feel more inclined that you have to work and you can't miss work because you can't miss out on a paycheck, or, factors that would force a person to feel that they can't miss work. And also just higher risk jobs. So these are jobs that are, on our essential worker list. So janitors that had to, man our, clean facilities and such, that put themselves at higher risk of infection, but a job that needs to be done. And who are the people that end up doing most of those jobs? So sort of looking at those factors. And then a lack of transportation that leads a lot of people to need to hitchhike to get to where they need to go, hitchhiking to get to the grocery store and get groceries, and not having access to transportation to drive by yourself. And if you remember back during early on in the pandemic, when we talked about isolation and sticking within your own household, and if your household doesn't have access to a vehicle to take you to the grocery store or to take you to a hospital appointment, and if someone is symptomatic, you're talking about, everyone sort of piling up in the same car to go to the hospital to be checked. And if one person's positive and a long car ride, and if the hospital is about an hour away, you're exposing each other, everyone in that car who needed to get to where they needed to go in that car ride, and everyone else becoming positive. And then also many jobs, not just here in the Navajo Nation, but these are just factors as well that you might see that might apply in other cities that you've probably been to or live in, but a lack of paid sick leave, or, just others feeling obligated to work despite illness. So a lot of people that, feel like, well, I can't miss work. And if I'm young enough and if I get COVID, I'm probably going to experience a common cold type of symptoms, and I should be fine and do well and survive COVID. However, I can't miss work. And if I'm well enough with the sniffles and a cough and I can hide my cough, but I still need to work, I'll probably still go. But not realizing that you're risking exposure to many others that at work, or other people that you would come across outside of your home. And living in close proximity. So I mentioned multi-generational households. So households that have children, grandchildren, and even including parents and grandparents that might have illnesses that put them at higher risk for severe COVID, such as diabetes, lung problems, people who have cancer, people who are on dialysis. And these are conditions that we have much higher numbers of on our Navajo Nation. Homelessness, so people who didn't have a sturdy roof over their head, that needed to bunk with another household. And so there's some mixing going on there. Incarceration, of course, and this is a factor that's known across the United States. So living in enclosed, close quarters, such as an incarceration situation, can really lead to high spread. and then a few grocery stores across our Navajo Nation that lead to crowding at these grocery stores and needing to travel further away from home or off the Navajo Nation to buy essential items. Back early on in the pandemic, when a lot of families wanted to isolate at home and you wanted to reduce your risk of needing to go to the grocery store more frequently, I think a lot of us families went to Costco or Sam's Club and bought food in bulk and brought it back home so that you could, hide out in your homes and be isolated from other people, and stocked yourselves up with a lot of food and essential items to be able to stay home. However, for families here in the Navajo Nation, if there are only a small number of grocery stores, I believe it was there's 13 grocery stores across the Navajo Nation. If Navajo Nation is the size of, comparable to the size of West Virginia, and if you can imagine West Virginia only having 13 grocery stores across the entire state, depending on where you lived, you'd have to drive quite far to get to that grocery store. And if you don't have access to, being able to buy food in bulk, or not having the financial means to buy and stock up in that manner, you're talking about needing to drive further, visit the grocery store quite frequently, but also gathering in some of the smaller, more nearer shopping centers to be able to buy the things that you need and paying higher prices for those things. Next slide. So this is a photo of one of our grocery stores here. This is the grocery store here in Tuba City. So lines that went all the way across around the whole entire complex, the building, people 6 feet apart, wearing their masks, and just waiting at the front door for their temperature screening check to get into the grocery store. At this time, because of the curfew restrictions, the grocery store was only open a certain number of hours. So if the grocery store was open only from noon to 4, more people gathered in this area and needed to drive all the way to town to meet this certain timeline, this narrow time window to get the things that you needed at this local grocery store. Next slide. Next part of the structure of health inequities, infection and complications. So higher rates of high-risk conditions for COVID. So here in the Navajo Nation, more people, higher rates of obesity, higher rates of diabetes compared to our non-native counterparts. So having a 2 times higher risk to develop diabetes compared to our non-native counterparts, but also 5 times more likely to have end-stage renal disease or kidney failure that would put someone on dialysis, whether that's hemodialysis or peritoneal dialysis, but higher rates of people needing dialysis with kidney disease. And then higher rates of heart failure, lung conditions like asthma and COPD, and hypertension. So this list was generated in terms of the conditions that led to higher risk for severe COVID or death. This list came out at the beginning of the pandemic when we started to look at trends across the United States of, who were the people that were in the ICU, who were the people that were, that were dying from COVID. And so they came up with this list of conditions, but also cancers on this list as well. So, there are just higher rates of a lot of these conditions. And myself as a family doc, day to day, my work seeing patients day to day, just about nearly every patient I see in clinic in family medicine or in our urgent care clinic has diabetes, and just a wide spectrum and higher rates of uncontrolled diabetes. And a lot of these health inequities and these structural things that we're talking about and listing here contributing to why someone would be uncontrolled as a diabetic and having much more difficulty getting a chronic condition like this under control. And all of these factors contribute to that. Next slide. Also under infection and complications. So sort of an idea of segregation, sort of being isolated to just reservation land and not having access, for a lot of reasons, access to things off the Navajo Nation. So I had mentioned grocery stores and not having easy access or transportation or the means financially to go off the Navajo Nation as frequently as others do to be able to stock up on essential items. Just a sort of a population experience of discrimination, a lot of border town racism. So a lot of people who leave the Navajo Nation to some of the towns just off the Navajo Nation to do some of their grocery shopping and larger essential item shopping that experience a lot of this, and just sort of decrease someone's desire to even leave to go to a lot of these areas to do the shopping that they need to do. Of course, there's a wealth gap and environmental adverse exposures. So a longstanding history of uranium mining on our Navajo Nation and a lot of radioactive exposure, downwind exposure. So radioactive dust from previous uranium or nuclear bomb testing that exposed all of these, a lot of areas on the Navajo Nation with a higher concentration of radiation exposure to our animals that graze and us subsequently eating these animals, and a lot of the exposure to the land area that we sort of depended on agriculturally. And so higher rates from, as a result of this, higher rates of particular versions of cancer as well. Next slide. And the protections that were sort of, we think of that should have been in place, or that a lot of other families perhaps off the Navajo Nation have access to, that I guess, without realizing that a lot of these things contribute to, a protective factor for reducing illness from COVID. So having a lack of access to clean water. It's well known that race is one of the strongest predictors of water and sanitation access, and that Indigenous populations are 19 times as likely to lack access to clean water. Having a lack of access to electricity, so not having electricity to have a freezer or a refrigerator to buy food in bulk and fresh items that you would want to keep in your fridge, and not having a fridge to be able to do that with. If you wanted to quarantine in isolation and stock up on foods, you pretty much have to depend on foods that are canned and dried. And if you don't have a refrigerator for medications such as insulin, which should be refrigerated for your diabetes, it's much harder for people to really care for themselves and their insulin and give themselves their insulin if we don't have a lot of these things to adequately control our conditions. And then lack of access to masks. This was an issue at the beginning of the pandemic, and I think it was a problem across many areas across the United States, but particularly here we had quite a tough time, and a lot of people pitching in to donate and sew masks and really trying to get that out to the people that needed it at the beginning. And then lack of access to effective isolation options. So back when someone was suspected of having COVID or having been exposed, if you remember the CDC and the rules back at the beginning of the pandemic, when we weren't yet we weren't yet up to par with our treatment options, and when the recommendation was, if you found out that someone at work you were exposed to was positive for COVID, or someone in your household was positive and you came across them and they told you a day later, like, oh, I tested positive today and here I saw you yesterday, the goal at that time was to isolate yourself in case that a couple of days later you do end up becoming symptomatic and then later testing positive, and sort of avoiding that further spread during either your high viral load asymptomatic phase or barely hitting that symptomatic phase, and then needing to tell people that you were exposed to in the 2 or 3 days prior to testing positive or your first symptom to say, oh, I had exposed all of you guys. And so the recommendation back then was, once you're exposed to somebody, and you should isolate, 14 days, 2 weeks, because that was the window within which you could potentially become symptomatic or be positive. And if you're living in a multi-generational household, and including a household that has members that are high-risk individuals, so elderly, or having someone who's disabled, or having someone who's diabetic and needs to go to dialysis every other day, one person who was exposed outside the home and came back home to the house, how are you supposed to isolate effectively in that situation? So we were tasked with trying to put out a messaging for, ways to do this effectively for households that were highly dense within one home, and trying to isolate themselves within that one home. And then having a lack of access to stock up on a surplus of supplies and food. So, I had mentioned this whole food desert idea, little access to grocery stores. There's no Costco nearby. There's no Walmart or a Best or Sam's Club nearby. And so, we couldn't stock up effectively, and not having the financial means for which to buy in bulk and be able to effectively isolate at home. Next slide. This is a photo of a family that was getting water to either take to their home for washing and cooking, but also a lot of people haul water for their livestock in a sort of changing climate these days, where a lot of our water wells and lakes and ponds that previously existed for our livestock, they're all drying out. So a lot more water hauling is happening across Navajo Nation. So this is just one of those photos. Next slide. And so supports, having low access to insurance coverage. And I think this is particularly true for Native people who leave their indigenous lands, who leave their reservation lands, where they get healthcare via the Indian Health Service, but needing to live and work off the reservation because there aren't enough jobs here. There aren't enough jobs for the things that you might be trained for, that you want to do to support a large household. So, a family member that needs to leave the reservation to work off-site or travel for work. And that's the case for a lot of our, union workers, boilermakers, welders, people who travel as iron workers. And, a lot of our households have a member or, a father that travels, a father or mother that travels for this kind of work. And if you happen to be sick and you're needing to work, and this kind of essential work is continuing throughout the pandemic, and if you happen to be stuck in another city somewhere and you fall ill, how do you go to get evaluated or treated? And if you become severely ill, what hospital do you go to if you don't have insurance coverage and you're not near an Indian Health Service facility to be able to help you? And that's a huge issue. Inadequate access to COVID messaging. So how do messages across this wide, expansive area, get out to the people that need to hear these messages? Someone who doesn't have electricity and doesn't have a television and maybe just has a radio, trying to get out messages via radio, programs, social media, but not everyone has social media, right? And cell phones, and trying to get out all these messages, and just a lack of good access to cell phone reception in a lot of areas across the Navajo Nation. And then language and health literacy barriers. Language is, it's not a huge barrier these days, because the majority of the population understands and reads English now. There is a decreasing number of those in older age groups that speak Navajo only and don't understand or speak English. So it's not a huge barrier as far as language goes, but health literacy is continually a huge barrier. So either having a low education level and, being able to understand messages that are put out there. For those of us who are comfortable with our health literacy and have a sort of, I guess, what you might call an adequate level of health literacy. You know, we can Google things and look up things and say, okay, well, I have these symptoms. And I know a lot of people are good at, you know, Googling their symptoms as well, which can be a plus or minus, especially for a doc like me, when someone comes in and say, I Googled my symptoms and this is what I think I have. But, you know, people having access to those kind of things and being able to read things on, you know, on the internet and find things to help find answers for yourself. But if you're, you know, if you don't have access to a lot of these things, you know, how do you find those answers? And how do you know what questions you have about your health if, you know, we're just not exposed to, you know, a higher level of health literacy or have learned a lot of these things? And so that's a larger issue. Healthcare provider shortage. Our physician vacancy rate is well over 25% across the Indian Health Service. And this is a higher vacancy rate than the rest of the United States. So just a huge need for more primary care physicians, more physicians, hospitalists that man our inpatient units, ER doctors, and just physicians across the board that, you know, our vacancy rates are much higher, and a higher physician turnover in a lot of our facilities across the United States. The majority of physicians staying less than 3 years and moving on. So there's just, you know, there's a lot of turnover, and it's hard to establish primary care in an area where physicians come and go. And that's a huge issue. Nursing shortage. So hospitals unable to make use of their full bed capacity. You know, you might have an ACU, you know, a nursing inpatient unit, an adult care unit that can house 50 patients, and you have 50 beds to house these patients. But if you don't have enough nurses, you can't make use of that full bed capacity. And you have to keep your daily admission rates down based on the number of nurses that you're able to find to staff that unit. And so in a lot of cases, and this is one of the cases, this is what happened to us as well, you know, a low number of nurses where we could only, you know, have 20 beds available, even though we had more beds physically there, but the number of patients that we could admit and care for, you know, those numbers were much lower. And decreased preventive services. So a lot of people, you know, not presenting for primary care or just sort of healthcare maintenance things, such as getting their colonoscopies, making sure they're up to date with all their vaccinations, increasing their risk of communicable illnesses. For example, not being up to date on your Tdap for pertussis, you know, vaccines, and being able to prevent whooping cough, you know, those kind of things. And there's still little outbreaks here and there for among those who aren't up to date on their vaccinations. Poor control of chronic medical conditions. So a lot of people not presenting for care and routine healthcare screenings, and finally, you know, showing up a couple of years down the road to the ER symptomatic with severely uncontrolled blood sugars, and finding out they're diabetic for the first time ever, and finding themselves with a hemoglobin A1C, you know, which is the marker for diabetes, you know, of hemoglobin A1C greater than 14%, highly uncontrolled, and having that sort of, you know, finding out at diagnosis that you're already quite uncontrolled. And, you know, people who don't present to care routinely, you know, another, you know, we always try to advocate for patients to come and get screened for diabetes when they're much younger. We are actually, especially given our higher rates of diabetes in much younger populations, you know, type 2 diabetes rates increasing among our teens, and screening that early, and sort of trying to promote a, you know, a process for getting screened for something, especially for something, especially as a diabetes, every year or every couple of years, to check that A1C and make sure that if we can catch it sooner in that borderline or glucose intolerance phase, to start to put all that education out there and increase the education and being able to intervene much sooner before it becomes uncontrolled. Next slide. And so this idea of resilience, this resilience is an ability to overcome stress and regain mental health and well-being after experiencing adversity. And Harold Cohen also said that when faced with a tragedy, natural disaster, health concern, relationship, work, or school problem, resilience is how well a person can adapt to the events in their life. A person with good resilience has the ability to bounce back more quickly and with less stress than someone whose resilience is less developed. And this is one thing that I actually wanted to really focus on, in terms of our resilience across the Navajo Nation and sort of the factors and the things that sort of we maintain and are actually quite strengthened by, that have united our people and been able to sort of make it through this pandemic, and just really supporting each other. And so actually back when I was doing presentations earlier on in the pandemic and this idea of resilience came up, and a lot of people kept asking, despite how bad it got across the Navajo Nation, what are some of the things that contributed to people coming out on top and having an excellent and amazing response rate to vaccination? Why is it that everyone came out to vaccinate at the onset of when vaccines were first released? Our vaccination rates skyrocketed, much faster and much better than the rest of the United States. We've plateaued now, of course, and we're trying to promote boosters and such, but our initial response rate was great. And so I asked a lot of friends and family and people that I'm connected to on social media, just sort of, and putting this question out there: what is it that that you thought of or that helped you to sort of continue to move forward and stay positive through this pandemic? And a lot of people sent me photos of with stories, and that's a compilation of things that I put together here at the end of these slides here. Next slide. And we'll go ahead and skip this one. So a lot of people had sort of sent me photos of families and this idea of when we all had to, when we were living in multi-generational households and our elderly in our homes, and we sort of had to isolate and quarantine and, really develop ways to pass our time in our households. And a lot of people look to their elderly for strength. And, a lot of our knowledge and our, teachings of, just day to day in life and things like that all come from our elderly. And so, of course, we all, collectively wanted to protect our elderly and do what we can to protect these most precious people in our lives. And, starting to do things in our homes that brought us closer to them while we were in quarantine, a lot of activities and learning how to cook old recipes and such, and spend time, between great grandchildren and their great grandparents. Next slide. And, children, when the schools were shut down and closed, and we all switched to virtual learning, which was another huge thing to overcome. When you don't have access to internet out in the middle of nowhere, how do you do virtual learning? And that was the case at the onset of this pandemic. And so a lot of, if we finally got access in our home to some sort of, the school gave us a hotspot to be able to access our teachers and a small lesson every day, that was our school days became very abbreviated, and as we stayed home, and our kids spent more time being outside and spending more time with the livestock, helping grandparents with the livestock. Next slide. And helping our grandparents prepare meals that a lot of the time when we're busy with other things going on, and if the world is shut down and the town is all shut down, what else do you do at home? You gather with your family and, work on recipes and such and things, and learn things from your parents and grandparents that you probably wouldn't really normally learn how to do. Next slide. and spend time with grandparents, with the livestock. And the person who sent me this photo, she was very touched by the time that her son spent with the great grandmother out at their sheep camp. And she just really felt that that time was precious to her. Next slide. And, you know, a son who spent a lot of time on their family field. A lot of people, you know, activities where you could stay away from other people and you're quite isolated, and you can work on planting and learning these essential things that your family felt valuable, and spending more time outside doing these things. Next slide. And including learning how to make bread. One of the women who sent me these photos of making bread, she sort of said, "Oh, you know, I finally." You know, making tortilla bread is it can be an easy task, and you can make it much more complicated to make the version that could be the most tastiest when it's cooked over an open fire. And so she said, you know, I finally perfected my dough making skills and started to sort of finally find ways to do this over the fire. And my bread's finally coming out great now. Next slide. And teaching our young ones, and when we're isolated and don't have access to a lot of grocery stores, and you know, I think a lot of our food deliveries had gone down as well. Families who are sort of picking up old traditions of butchering your own sheep and teaching your young ones to butcher the sheep so that we have meat for the family. Next slide. And a part of caring for our livestock is shearing the sheep, and families gathering and going outside and doing things to take care of their livestock and shearing, and teaching our young ones how to do this task. Next slide. And also spending more time, you know, out in nature. And the mom on the right with her kids, you know, she was very happy to spend more time with her kids out in a remote area where she grew up, and showing her kids the beauty of the area that she grew up in. And, you know, having a nice place like this to quarantine in it's pretty great. And these children that are learning a lot of to prepare more traditional foods, as is the case on the left with the little girl who's grinding corn. Next slide. And a mom who has spent her quarantine time, you know, really developing her garden, and very proud of what she was able to produce from her garden. Next slide. And getting back to things that we thought we didn't have time for. If your job is closed, and if your primary job was to travel for work and be a welder for large factories and such, and there's no jobs going on, you get back to some of the things that you didn't have time for previously, like sewing things, traditional items, you know, learning how to. The woman who sent me this one was teaching her daughter how to, you know, do archery. Next slide. And this, I think the person who sent this to me had this home was built during the time of the pandemic, and the family who was there. And then the picture on the right is a picture of a wedding, and the person who sent me to this said, you know, these are one of the things they cherished, and sort of being able to continue during the course of the pandemic to prepare things while in quarantine and isolation, so that we can pick up with a lot of these traditional ceremonial practices, and just really realizing how cherished these practices are, and looking forward to a time when we can continue to gather and do these things again. Next slide. And this is a photo that a classmate of mine from high school, her mom is on the right, and she takes care of her mom and the mom's sisters. So these are three sisters, and you know, my friend, she was very, very strict with her mom and her aunts, you know, very making sure they adhered to guidelines. And when they needed to go somewhere to the store, you know, she made them stay in the car, and she did the grocery shopping for them, and, you know, doing a lot of things to protect them. And in this photo, they actually went to visit their brother, and their brother actually lost his son and they really, really felt that they needed to see him and pay their respects. And so so they were told, you have to stay far away. You can't get near him. And I believe the son had died of COVID. And so they went to go pay their respects. Next slide. And this photo is them visiting their brother, standing far from him and, talking to him and, consoling him because he had just lost his son. Next slide. And this photo was sent by, a woman who, felt like the elderly in her family. She felt like looking at this photo made her feel more motivated and overcome her fears that everyone else felt about getting vaccinated, and really her fears, throughout this pandemic to really get through and do what she needed to do to protect the people that she cared about the most. Next slide. And just a couple of other older photos that people felt like meant a lot to them, and older generations doing things that they were taught to do later on. Next slide. And when you're stuck in the middle of a pandemic and you're trying to as a physician, going day to day, triaging patients that are severely ill, and you're trying to you're sort of you come to your wits' end because people are coming in every day very sick, and a lot of these patients come in so sick by the time they get to their hospital that they end up needing to be intubated, or they're coded inside the ER, and a lot of them ultimately pass. And even if they survive intubation and end up in an ICU, ultimately passing from their complications subsequent to that, a few weeks down the road. And just this realization as a doctor, you couldn't give them a magic pill or a magic medicine to say, this is going to make you better. This is going to make you survive. This is going to take away those symptoms, make you breathe better. And this is going to remove this virus, remove this illness so that you can go back home to your family. You felt very defeated, as a doctor, and just really trying to figure out how else can you help? How else can you help everyone else that's stuck out there, stuck at home, not, preparing for this oncoming winter? And this is exactly what my family did. I was very moved when my family said, there's a lot of people out there that need firewood, a lot of homes that need to be warmed. We should just go and try to collect as much as possible. And then writing proposals and finding access to this huge amount of firewood. These semi trucks pictured here, 35 of these rolling into town to dump logs, day after day over the course of a month, and preparing those logs into those piles on the right to be delivered to families. Next slide. And family coming together to sort of then realize and accomplish one big common goal, and bringing the community together. Next slide. And bringing your community hospital together. Up on the left, that's left upper photo, that's me running a chainsaw, and behind me is our oncologist, our cancer doctor at Tuba City has the only cancer center on the Navajo Nation, and even on IHS lands, IHS facilities that do care on Native lands. We have the only oncology center in the nation, and then the orthopedic doctor also in that photo. There's a pharmacist here in the middle, her husband, who's the general surgeon right there with the axe, a fabulous ERPA and his wife who came out to help split wood, and then our psychiatrist running the saw on the bottom right with the oncologist. Next slide. And all of us, we were sort of reassigned, and we sort of had all these alternate duties, and we were pulled from our routine clinic duties. And the pediatrician on the left upper photo, she ran our epi response team with an amazing team of physicians, and she also leads sort of epi response activities for the rest of the Navajo Nation. She came out and sat at a splitting machine and sawed and split wood, and it was just a very relieving thing for us as physicians to come out and do something different that was much more meaningful, and see, for a lot of these people that came far and wide, a corrections officer and his wife. The right is right upper is a bishop and his elder missionaries who had come out to haul wood, a police officer and his family on the bottom middle there who came out to help saw as well, and then a chapter president who had come out to split wood and take wood to his community. Next slide. And, I had a patient of mine, actually, this guy had actually come out and sawed every single day, brought his wife in the bottom right photo, and him and his wife are loading up trucks and stuff, and his son in the upper photo. And they came day to day. And one of the days that I was taking a break, I went to talk to him and I said, what is it that brings you out here? And, I really appreciate it. He's a very quiet man. I said, well, I really appreciate that you're able to come out and do all this work and bring your family. And he said, he started off by saying, I'm out here because of you. And I thought, what is that? How so? And he says, I was really sick last year. And then he said, I was getting sicker. And then 6 months ago, he said, I came to the hospital. I had been to many ERs and hospitals, and I was trying to figure out what was wrong with me. I was hurting and things were not right. And I came to see you and you listened to me. And right away, the next day, you got me set up with the surgeon who's holding the axe there. And the next day, they found out I had colon cancer, and they found it early enough that they could take it out. And, they set me up with the oncologist who's sawing up there on the left upper corner. And, he said, I'm in the middle of my chemo. I finished that. I'm about to have, had my surgery, and I have, he's sort of, he said, I'm really proud to be alive right now. I'm here right now with my kids and my wife because of you. And he said, I told my family, Dr. Calderon's doing this, work for the community. We're going to go out and help her, and we're going to be out there every day because, this is something that our doctors do for us, and that, we should return the favor and help our community. And so it was really great to see all these people working side by side. Next slide. And our Navajo Nation president, who came during one of our vaccine events, I tried to communicate with him as much as possible. And one of his visits to our town during a vaccine event, I grabbed him. I said, hey, you know what? There's this project going on. It'd be nice to come. You should come check it out. So he came out to saw for a little bit, and felt like it's great to see community members and people come out to the community to do something for themselves, and to really band together and do something great like this. Next slide. And, at the end of the day, working all day, triaging in the ER or seeing patients and trying to, swab patients and dealing with patients who are grieving, losses of loved ones to COVID, just coming to the woodlot at the end of the day and just sitting at a splitting machine was very therapeutic for me and many other physicians that got to come out. And to think of the elderly and these families on the right that got to receive the wood that you sat hours splitting, and to know that it was going to something greater and that it was helping people that were isolated at home. It helps them to stay isolated at home and stay warm and not end up in your ER sick with COVID, and, thinking that what you're doing is going to help them in their isolation and quarantine to stay home and stay well. Next slide. And ways to advocate. I'll go ahead and leave this slide. I think you have copies of it, but just sort of overall, helping in this effort of advocating for Indigenous people and for Native people across the United States for, better data collection, better access to health insurance, equitable relief packages, worker protections, advocating for people to have better affordable housing, water and electricity access for homes that need it, providing information out there, having information available for people, especially for people who have who don't have adequate sort of access to health who have sort of lower health literacy, making information more understandable for people and making it easier for people to access information if they have questions, about their health or healthcare, having better access to preventive health services, information that they can find out and know how to, what they should be doing year to year. Should they be getting their screening colonoscopy? What vaccines should they be getting? All that kind of stuff, and making that information readily available helps a lot. And then having mental health support, having compassion for those that are affected. Next slide. And those are my references. I think that's it. Thank you so much for allowing me to talk today, and for giving me this time to share this story and a lot of, the ways that, and sharing with you the positive side of things, and having a positive view of some of the things that have helped us to get through this pandemic. And any questions if we have time?
Thank you so much, Dr. Calderon. That was very interesting. We're kind of run past time, so we do have a few people on here. And I'm looking, I don't see any questions at this point. But yeah, it's just was really heartwarming, and really thank you so much for taking the time to share your experience with us. Truly, truly appreciate it. So we'll just wait to see if there's any questions that pop up. I don't see any at this point. All right, great. Yeah, thank you very, very much. Yeah. Let's see. Okay, so actually there is a question. Knowing what we know now, how can we address issues before they happen, like another pandemic? If you have any ideas.
Yeah, especially sort of looking at it and evaluating a situation, or an area that would be more highly susceptible to experiencing a bad outcome for a pandemic such as this. Looking at all of those health inequities around you that exist, and trying to look for things that can help improve those things now that could help potentially down the road. Hopefully not, but if a different or another pandemic should occur, that would give those people the best chance at surviving that pandemic, having a better experience to get through that pandemic, and not losing so many people. So looking at those kind of factors around you, and looking for ways to help reduce those disparities.
Great, thank you very much. Let's see, we have another question. So how did you see nonprofits outside the Navajo Nation respond to the pandemic? And was there help enough at the time of the crisis? I'm thinking of organizations like Team Rubicon and the response teams that were in Gallup and Chenelle, and have since returned to those locations to provide healthcare services again.
Yeah, we actually had a great relationship at the onset, a huge response of a lot of people off the Navajo Nation, nonprofits and other organizations that came to visit the Navajo Nation and bring a ton of services and supplies. At the onset of the pandemic, if you can recall, we had very poor access to testing. And back then, at the onset, you were only tested if you were sick enough that you probably would be needed to be admitted to the hospital. Then you would get a test. And back then, our access to tests were so small. And so organizations came in to help improve our testing capacity. CORE is one of the organizations that came out to the Navajo Nation and helped to provide supplies, and to provide ways to help us test more effectively, and testing blitzes that we held across the Navajo Nation. And so, there were a lot of organizations that stepped up, providing masks and other supplies to help quarantine, more food and more items that would help people to effectively quarantine at home and be at home during our lockdowns. So a lot of people came, and I think from the medical side, there were a lot of organizations that came out, like was mentioned, Gallup and Shinli, and to multiple areas across the Navajo Nation. So we sort of had a collective effort. And actually, there was a huge response that the Navajo Nation sort of then had to centralize a lot of the help that was coming in. So instead of people coming in and choosing where they wanted to go and help, I think a lot of that help was then managed and dispersed from headquarters of the Navajo Nation to help sort of spread out the help across the Navajo Nation.
Okay, thank you very much. Really appreciate you being with us here today.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.